Hey guys, welcome to another session on FMT. Today we'll discuss identification of a person. In this we'll restrict ourselves to determination of sex of the person. You should be able to define and describe corpus delicti, establishment identity of a person including race, religion, complexion and sex. Let's begin with a case study. Skeletonized body parts were found in a wooded mountainous area with bones scattered in about 20 meter square area. There were no personal effects that could point to the identity of that person. The remains were collected and arranged in an anatomical fashion and identity of the person was attempted. The question that has been raised, as a forensic pathologist, what is your opinion regarding the sex of the person from the given skull? So have a close look and then we will discuss at the end of this session. This is a skeleton which was found and you have been given a skull to try to find the sex of that person from the skull. Now for some definition, identification is the determination of the individuality of the person based on certain physical characteristics. So you are determining the individuality of the person and it is based on certain physical characteristics. It can be complete, that is absolute fixation of the individuality of a person, or it may be partial, ascertainment of only some facts like race, sex, age, stature, while the others still remain unknown. So you know some facts but you are not able to identify the person properly in whole. So it is called partial identification or incomplete identification. So why identification is necessary? In living person, for criminal cases like persons accused of assault, murder, rape, interchange of newborn babies in the hospital, impersonation cases, absconding soldiers and criminals. So you want to identify who is this person. In civil cases, marriage, passport or license, inheritance, insurance claim, missing person and disputed sex. In the dead, identification is required in case of fire, explosions and accidents, when an unknown dead body is found on the roads, fields, railway compartment or in the water, in cases of decomposed body, in case of mutilated bodies and if it is a skeleton. Before identify the accused in the court of law, the doctor should verify the identification marks noted by him. Now there is a term which comes as a short note for you. What is corpus delicti? Body of offense or the essence of any crime. That is corpus delicti. That is the facts of any criminal offense. In charge of homicide, it includes positive identification of the dead body, that this is this person only and no one else, and proof of its death by some criminal act of the accused. The term includes body of the victim, the bullet or a broken knife blade, the clothing showing marks of the weapon or photograph showing the fatal injuries. The main part of the corpus delicti is the establishment of identity of the body and infliction of violence in a particular way at a particular time and place by person or persons charged with the crime and no one else. The identification of the dead body and the proof of corpus delicti is essential before sentence is passed, since in trials any unclaimed body or a decomposed body or a portions of the dead body or bones may be produced as to support a false charge. Now what is the identification data? Race and religion, age, sex, teeth, general development and stature, anthropometric measurements, fingerprints, footprints and any external peculiarities, speech and voice, memory and education, handwriting, gait, manner and habit. This speech, voice, memory, education, handwriting, gait, manner, it is possible only in a living person. Personal effects like clothes, pocket contents, jewelry. Sex, age and stature are said to be the primary characteristics of identification. Sex, age and stature. They are said to be a primary characteristic of identification. Race and religion, important in cases of mass disasters. Example, in case of railway accident, air crash, when a person of different races traveling together. It is determined by clothing. Traditional Indian dress is different from Western dress. Even in India, people can be identified of their place of origin from nature and manner of wearing the dress. Complexion, skin is black in Negroes, brown in Indians and fair in Europeans. In the eye, the Indians have dark or brown iris and Europeans have blue or grey iris. Skeleton, there is a very important index which is known as the cephalic index. So cephalic index or the index of breadth. What's that? It is a ratio between the maximum transverse breadth of the skull. You are taking the breadth of the skull and the maximum anterior-posterior diameter of the skull. So maximum transverse breadth and the maximum anterior-posterior length into 100 gives the cephalic index of that skull. It is helpful to determine the race of that person. So cephalic index is useful to find out the racial difference from the skull shape. So maximum transverse breadth of the skull divided by maximum anterior-posterior length of the skull into 100 is the cephalic index. Indian skull is Caucasian with few negroid character. So it is Caucasian and with few negroid characters. So what are the types of skull based on cephalic index? The dolichocephalic, where the cephalic index is 70 to 74.9 and the skull, the race of the skull are the negroid. The Negroes, the Aryans, the Aborigines, they are included under this, the dolichocephalic or the long-headed skull. Next we have the mesocephalic or the medium-headed. Here the cephalic index is 75 to 79.9. Race that is included are the Caucasoids. Here we have the European, Chinese as well as the Indians, the Caucasoids. The third one is the brachycephalic or the short-headed. The cephalic index is 80 to 84.9. The short-headed, they have got the cephalic index from 80 to 84.9. And the race included in this are the Mongoloids. We have the Mongolians and the Native Americans. We have another category which is also known as the hyperbrachycephalic, but they are very rare. The maximum anterior-posterior length, which is measured by a vernier calipers. That gives the cephalic index. So religion, how to classify or identify a person based on religion, they are sometimes very difficult. Hindu males are not circumcised, sacred thread, necklace of wooden beads, caste mark on forehead, piercing of earlobes may be there. Muslim males are normally circumcised, have marks of corns and callosities on the lateral aspect of the knees. Hindu females put on saris, vermilion on head, silver toe ornaments, tattoo marks, nose ring aperture in the left nostril, and few openings of earrings along the helix. In Muslim females, put on trousers, no vermilion mark, nose ring in the septum, several openings on the helix for earrings, and there is usually no tattoo marks. But it can be varied. Now let's discuss an MCQ. Cephalic index for Indian people. We have discussed it is Caucasian with few negroid characters. So that means it comes into the mesocephalic group. So the options given are A 70 to 75, B 75 to 80, and C 80 to 85, and D 85 to 90. So mesocephalic is 75 to 80. So the answer will be B. Right? Now we come to determination of sex of the person. There are some terminology you should be aware of. Sex is the biological term denoting the genetic, physiologic or anatomical characteristic of an individual based on which we identify ourselves as males or females. So it is a biological term depending on genetic, physiologic or anatomical characteristics. So that is the sex, whether male, female. Gender is the sociologic construct that denotes how an individual identifies according to the social norm. Sexual identity of an individual from birth to puberty and then to adulthood. It is the intermingling of sexual characters of either sex in one individual to a varying degree, including the physical form, reproductive organs and sexual behavior. So in one person there will be intermingling of the behavior of both the sexes. Davidson divided intersex into 4 types: gonadal agenesis, gonadal dysgenesis, true hermaphroditism and pseudo-hermaphroditism. Agenesis means when there is no development of any gonads, no testes, no ovaries are there. Dysgenesis, development is there but they were not functional at the time of puberty, and most common example is the Klinefelter syndrome are the Turner syndrome because of some abnormalities in the chromosome. So Klinefelter XY and Turner's XO. They are examples of gonadal dysgenesis. True hermaphroditism, when both the sexes are there. It may be ovotestis may be there. So the external characters may be also be that of both the sexes. Pseudo-hermaphroditism can be male pseudo-hermaphroditism or female. Male is that when the testis is there but the outward look is that of a female. And female pseudo-hermaphroditism is that when the ovaries are there but the outward look is that of a male. It happens because of some enzyme deficiency or some hormonal effects. Disorders of sexual development. This is the current terminology that is used instead of hermaphroditism or pseudo-hermaphroditism. So this current terminology is disorders of sexual development. DSD is a broad term encompassing any condition where external genitalia are atypical in relation to chromosome or the gonads. Currently the term DSD is used to substitute the obsolete nomenclature of intersex, hermaphrodite or pseudo-hermaphrodite. You are not going to use this term but use the term DSD. Why determination of sex is necessary? It is necessary because of the following reasons, like identification in living or dead, for deciding whether an individual can exercise certain civil rights extending to one sex only, for participation in sports, very very important. So any sports activity we have got male and female category. You cannot expect the male to compete in the female category. So there is some requirement to segregate them into male and female. For deciding questions relating to legitimacy, divorce, paternity, marriage, impotence, rape and affiliation cases. The sex of a person can be determined from the physical morphology, the microscopic study of sex chromatin and gonadal biopsy. In normal cases, in the living, most certain evidence of sex is the position of ovaries in females and testes in males. If it is there, you can say it is male or female. Highly probable evidence of sex is position of sexual characters like developed breast, vagina in females, and in male distribution of hair and penis in males. Presumptive evidence of sex is outward expression of individual features and contours of face, clothes, voice, figure that may help you to identify whether it is male or female. So there is the presumptive evidence of sex. There may be some difficult situations, like identification of sex of an individual may become difficult in DST, natural or acquired like the hijras or jananas. There may be features resembling one sex and the internal gonads could be of other sex or both sexes. Transvestic, individual who cross-dresses for sexual gratification or maybe otherwise wants to be related with that sex. Transgender, individuals whose identity or gender expression not matching one's assigned sex. Transsexual, individuals who have undergone sex change surgeries or sex reassignment, male to female or female to male. Concealed sex, individuals who hide their real sex for a motive by cross-dressing. This can be detected by physical examination. And in cases of advanced decomposition and in skeletonized bodies, the sex can be determined in decomposed bodies by identifying uterus or prostate which can resist putrefaction and by examination of the skeleton.